Okay, so part two of our subsection on cultural formulation interview under culture and psychiatric diagnosis. So the rest of the content that I pulled out of the DSM, or highlighting here from the subsection, is about what I thought were a very relevant list of things that can benefit the entire assessment, diagnostic, and intervention planning process by infusing cultural formulation, the cultural formulation interview, infusing those components of the either using the templates and infusing them into your own assessment, or doing them separately, which you could do. They're designed that way. I think it's more realistic and ultimately helpful to and organic for the client to, and hopefully perhaps you too, to really make that part, just infuse that into your assessment so that it's not so much you're doing a separate cultural formulation interview, but you're infusing the cultural formulation interview concepts into your assessment. So anyway, so I think these are benefits that I would agree with, that I think that can be helpful um, in terms of the process of gathering data. Plus, you're more likely to get data if your client feels like you're genuinely trying to connect with them and understand who they are and hear their perspective, hear their problems, their struggles, see the world through their eyes. And I think the more you're conveying that you are attempting to do that as best you can, um, and seeking to clarify that you're like, okay, this is what I hear you, this is how I interpret hearing what you're saying. Do I have that right? And that kind of thing, to just build, those are building blocks to getting more data, right? It's not necessarily the entirety of the purpose, but one benefit is to get more data, and that'll help you map with that data to mapping criteria process if you have more data. All right. Um, it Let's see. So it helps with, we're all human, and bias is a part of the way our brain works, and so our job and our responsibility is to sort of be aware of that and navigate through it and mitigate it. And the process of doing these concepts can help us with that endeavor. Um, Mistrust of healthcare institutions because of history, trauma, and oppression. Um, I think social welfare systems and other relevant uh, infrastructure systems that our clients encounter, that we encounter, um, can be shaped by bad experiences. Okay, so it's not just limited to healthcare, and that can shape how your clients are engaging you, and where their level of trust that they're willing to uh, indulge in, and how what your the task you have in front of you of building trust. So and then the last thing, I mean, you can read it, but um, one of the things that I remember from particularly my acute care days, and then actually other experiences too along the way in different settings, is oftentimes there's a dismissal of patients, of clients, as treatment resistant or malingering. And a lot of times, as I look back on that over the years, um, that many times those words are uttered by people, by clinicians, social workers, not social workers, behavioral health, or non, other types of healthcare, uh, is that they haven't looked at the whole of the client, the patient. They're not factoring in all these social and cultural components that could be hugely impactful to their state of health and their state of mind, as well as their ability to benefit from whatever treatment we're providing. And it was never mentioned, those kind of things early on for me. So when we're going back through this now and seeing a more evolved version of the DSM, and again, I'm not trying to sell you like, hey, the DSM is great. It's perfect. No way it's great or perfect. But it is progress to me. And so I think one of the things about getting all this stuff and being a better social worker, better clinician, because through these things you're more competent in terms of culture and also of just social determinants uh, overall, and truly seeing the totality of any client's life and health and social aspects. We're going to get better outcomes. It's going to be a better experience for them, and frankly, I see it as a better experience for you and any other credentialed provider, healthcare provider, that is in behavioral health or other types of health. If they're willing to engage in these things and these awareness and these techniques to infuse cultural formulation and social determinants of health, I think the experience for the provider is better too. So I find this stuff really important, and why I wanted to get through some of the stuff before we get into some of the health conditions themselves, which we are going to do very soon.